topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Houston. Welcome to another Ask the Expert show. We bring you the top experts in the field of legal, health, financial, and home improvement. We usually talk to our experts before the show and kind of try to decide what questions we're going to do. And this is amazing. This show that our first show we're doing today, turns out that 3 months ago, we did a very similar show, and it turned out numbers-wise to be one of our biggest shows we've ever done because we're talking about all the new technology there is in dentistry. And I was so glad we decided to talk about this area today because 3 months ago, it was a huge show, and of course, it went by really fast. Let me introduce you to our longstanding expert, Dr. John Van Slate.
Hey, Steve-O. Good to see you today.
Gosh, when we discussed what we're going to be talking about today, John, I was like, gosh, that was our biggest show. Do you remember doing this show?
I do.
Yeah.
I do.
Oh, my gosh.
Yeah, and I remember you were telling me about that, so I thought, man, it might be good to do this again and maybe bring in a few other things that are new. So that's
absolutely,
yeah.
John, it's so easy doing the show with you. It's not only your knowledge but your personality. Tell people about your practice.
Well, I'm a general dentist. I practice in Houston, kind of in the Galleria area. I've been here for a little over 30 years doing what I do, and I do everything that you can imagine. I probably do more high-end cosmetic stuff, sleep appliances, lots of TMJ. That's really the stuff that I do most of. And of course, we restore a ton of implants. But yeah, I've been here for quite a while and just enjoying what I'm doing.
Yeah, it's so obvious. John, what's so amazing is I'm from old school. When I hear I'm a general dentist, I think about pulling teeth, filling cavities, but you go so far beyond any of what just a general dentist does.
Yes. Well, it's really funny because I always thought about specializing way a long time ago. And in retrospect, I'm honestly so glad I didn't because in dentistry, it's great. You can reinvent yourself so many times and you might love doing one thing and you can start doing that one thing you love a lot. And if you were a specialist, you'd just be doing the same thing all the time. So it's been great for me just being a general dentist. I'm loving it.
How do you keep up with all the new things that are happening?
Well, it's really education, Steve-O. And I know we've talked about that a lot. In dentistry, things change so rapidly. And I tell people all the time, what I learned in dental school, almost nothing I learned is the way we do things now. So you have to stay on top of it. You got to be educated and you have to be really good at just keeping up with things.
John, we got a text yesterday. They saw that your show was coming up, and it was somebody that was thinking about having implants done, but having them done in Mexico because they advertise it's cheaper there. I could care less.
Yeah.
Tell someone, I'd rather them hear it from you, while that is not a good idea.
Well, it's one of those things where I can't speak for wherever they're going to. I can tell you this, being Houston, being close enough to the border where I do see a lot of work that's been done there, there's no regulations there. And so you can really do whatever you want over there, and you don't know the quality, the type of materials that are going to be used. And I've seen some work that's okay, but I've seen a lot of work that, golly, you wouldn't want to put on your animals, So I don't know what to say. I mean, it's one of those things where you just really have to do some serious research to make sure where you're going would be reputable enough to want to do something like that.
Just the fact that, just like, what if you fly back home and something goes wrong? I mean, it's not like them being in Houston and they go see you the next day.
Yeah, you're exactly right. Yeah, in dentistry, a lot of things do take successive appointments and monitoring appointments, seeing how people are doing after a surgery and things like that. And you need to be able to have access to that kind of care.
So we're going to be talking about new things going on in dentistry. Let's just jump into it. Tell us about some of the new happenings in dentistry.
Well, we briefly touched on a little bit about the video AI software that's coming out now. And, this has really been interesting for me, because what this software does that we've never really had in dentistry before is this company uses our digital radiographs now to find things like dental cavities, to find buildup. They can find bone loss. And so it's like having another dentist in the room. It actually gives you another set of eyes to kind of confirm things that you might be seeing, especially those gray areas, or those areas where you're not sure are you really seeing decay on an x-ray, but this picks it up. And I got a little picture. It's kind of interesting, but this is the kind of readout that I get on this, and you can see how it'll show you exactly where the cavities are. And this is the bone loss. So it's really an interesting tool, and it's really taken us to another level in our care, because, in dentistry, you want to catch things early, because catching things early saves people a lot of money, pain a lot of times, and things like that, because with this technology, we're able to see things we probably would have neglected had we not had this. So I really am thrilled with this new technology, and we use it every day, all day, on all of our radiographs now.
We just got a text in from Sugarland. I have 3 kids. What is the best thing to do for my kids' dental needs so I don't have big expenses later on in life?
Well, my goodness, it's so funny. I was talking to Rebel just earlier about this. The best thing anybody can do is don't wait on getting dental care. I would say that certainly 2 years old is not too early to see the dentist. 3 years old certainly is not too early to see the dentist. You want to go in there and make sure that you can catch things before they happen. And for young kids, it's usually developmental. You want to make sure that skeletally they're in a good position, the teeth are in a good position, and there's so many things you can do on a young child to develop the arches and to make sure the bone is correct. But you got to go see the dentist. And certainly you don't want to let things go until all of a sudden you need teeth pulled as a young person, because the most important thing about baby teeth is that they hold the place for the permanent teeth. And so you really want to make sure that those are holding up well, and that they come and that they are removed from the mouth in a proper manner, or they exfoliate from the mouth in a proper manner, so that they hold the space for the permanent teeth. So just critical that you go in and just get regular checkups at a young age.
Is there a rule of thumb with brushing your teeth?
Brush them.
But I mean, you hear so many people say they do it 3 times a day.
Yes.
One,
I would say
that
you want to brush at least twice a day, Steve. You want to be water flossing or flossing at least once a day, and mouth rinsing daily. That should be the bare minimum for people. But it always amazes me, some of the most important times to brush are going to be right before you go to bed, because what you're doing is whatever you've eaten throughout the day is just going to sit in your mouth for those sleeping hours. So I'm amazed at some people who neglect brushing before they go to bed. But I would say a minimum should be twice a day, and certainly brushing every time you have anything, anytime you eat or eating something sugary. You can't brush enough, right? I mean, brushing is more than you need is better.
Here's another text. Oh, this is a good question. How can I prevent? They spelled it wrong. I think they're talking about bad breath.
Okay. Well, breath issues are a couple things. I'll just throw a few things out that I see a lot with breath. Okay. If you're getting food and things caught between your teeth, Okay, it could be an issue with just making sure that with dental work or restorations or spaces between teeth, those are taken care of, because any place that you have where food can stay and it's hard to clean out can give you bad breath. We have papilla on our tongue that for whatever reason holds bacteria. So brushing your tongue, as weird as that sounds, is a really good thing. There's something out called tongue scrapers that you can use where you put it on the tongue, scrape it forward. It'll get rid of some of that bacteria that can cause a bad breath. If you have tonsils, you have folds in your tonsils that can collect food, and they're called tonsil stones. A lot of times we have to clean those out. That could give you a bad breath. And then certainly foods you eat, like curry foods, spicy foods, those tend to have, cause more of a bad breath issue for some people. So it's multifactorial, but the best thing you can do is just do a great job cleaning your mouth and using a mouth rinse daily. And that's usually, hopefully, the best thing you can do.
John, I remember the last time we talked about this, you talked about how you can heal cavities.
Yes.
And can you tell us more about that?
I can. I'm glad you brought that back up too, Steve, because this is a product called Curadon, and it's a new product. It's been used a lot in Asian countries, been used a lot in the European countries. We just got FDA approval at the beginning of this year. So we've been using our practice for about 8 months, but it's a very simple product to place. It's like a gel. It takes about 5 minutes to put on. No anesthesia is needed. But what it is, this gel has an affinity for weakened enamel, and it acts like a scaffolding where it just kind of binds to the tooth, and then the natural phosphates and things, calcium in your saliva, bind to it, and literally can remineralize broken down enamel. Now the key is you have to do it on early cavities. If the cavity is already too deep, you can't use this material. But it's great for those cavities, small cavities between the teeth, because anything that's going to prevent me from having a drill between the teeth down and going through a lot of healthy tooth structure is just a huge win-win-win. And we were talking about my AI earlier. Well, that artificial intelligence is exactly good for that, because it'll find those early lesions where I might be able to use this Curadon to heal. And so they go hand in hand. And this could be a game changer, because, us poor dentists, we're doing everything we can to put ourselves out of business. Now we got something that might be able to just eliminate cavities, but it's a big deal, and it's exciting for us in the dental world. And we've been wanting this for a long time. We're finally able to provide it for our patients.
Is there any news that you can treat or heal gum disease? Because that's really big too.
Something like that. Well, you know what? I will tell you this. Gums, again, the best thing you can do is get regular checkups, get your dental cleanings done. Again, periodontal disease is something you want to catch early, okay? And regular cleanings is the best way to do that. But there is a product that we've been using for actually a few years now called Perio Protect that has been phenomenal for my patients. And what this Perio Protect is, it's also a gel that you apply on these trays. And I got a tray right here. You apply it in this tray, and the tray, this is a Perio Protect tray that we get from Perio Protect. It has a seal on the top, this little special design seal that's got kind of a hydrostatic push that push the gel deeper in the pockets, literally kills the bacteria that causes periodontal disease. We've never had anything like this, and it'll reach areas where brushing and flossing don't reach. So I think it's as important as brushing and flossing your teeth, but you got to use it 15 minutes a day. That's the key. So you got to find those 15 minutes to do. And like me personally, I use it in the shower. I'll put the gel on, go into the shower, take it off. But this gel, anybody who has bleeding gums, anybody with existing periodontal disease really needs to have these trays, because it's the only thing they can do at home to kill the bacteria that's causing their problem. And I'll be honest, once you get to be about 50, about 95% of people are going to have periodontal disease somewhere in their mouth. So it helps everybody. But that's the Perio Protect, and we're doing a lot of it right now, and I'm seeing results with healthier gums like I've never seen without these trays. It really helps.
John, tell people what can happen if they don't take care of their gums.
Well, of course, periodontal disease, just by definition, that is bone loss and the gums wearing away from the gums, recession, gums, and inflammation of the gums. So Always, if people don't take care of their gums, you got to realize it's a progressive chronic disease. It doesn't slow down. It just keeps on going. And once it starts, it's hard to stop that engine from running. And so it ultimately can lead to bone loss and loose teeth. And so we don't ever want that to happen.
You just showed us an impression before, but is there something dentists are using now instead of those messy impressions?
Yeah. And, I've got this little guy. I know last time I didn't have this up, but I'm going to try. This is called an iTero. It's a digital scanner. Okay. And I didn't show you this last time, but this little digital scanner, it's like a video camera. You put it in the mouth and you go around the mouth and it makes an image that looks like this. Okay. And what I can do with this image is I can then email it to my lab, and the lab has a perfect model to make crowns, to make partials, to make bridges, sleep appliances, bite guards, anything. And the beauty of these things, number one, you don't have to use the impression material, the gooey stuff you're talking about, but the accuracy is unbelievable because there's no distortion like you get in an impression. This is an actual mirror image. And so the restorations we're getting back are just remarkably better, take less adjustments, easier to put on. And, I couldn't live without my digital scanners now, but it's a phenomenal piece of equipment. I've been using mine now for, probably well over 10 years, but the improvements in them have gotten so great. The capabilities we have, you can do them so quick now. Like I can make this scan in probably less than a minute. And that means they can get their restorations quicker, better fitting. And again, I couldn't do without this piece of
John,
equipment.
how do you make room for all these new techniques that are coming in? What do you do with the old
You
stuff?
just keep on going, man. You just got to roll with the flow. You just keep going.
I can imagine your office. Let's tell everybody where your office is.
Sure. Well, I'm just west. I'm in Tanglewood area of Houston, just west of the Galleria, and I'm in Tanglewood Professional Building. I've been here for over 25 years in this practice, and just Greater Houston. Anybody in the Greater Houston, I'm pretty centrally located for any of those folks.
God, I hear laser when it comes to dental. There's got to be so many things you're doing with laser now. What do you do in your practice? What do you do with laser?
Yeah. Well, lasers we use lasers all day, every day in our practice. And I know we've had shows where we've talked a little bit about lasers too, but the lasers, everybody that comes in our practice and gets a cleaning, we do laser cleanings, Steve, where you're going to use a laser for laser bacterial reduction. What that means is that the beauty of the laser is it literally kills bacteria. And the scalers that we use and the ultrasonic scalers that we use are great for removing stain and buildup and things like that, but they don't really kill the bacteria. So we can use a laser to go below the gum tissue, completely painless. That it spreads out like a flashlight under the tissue, and it kills bacteria, not by the hundreds, not by the thousands, but by the millions. It will kill the bacteria. We get an effect that'll last almost 3 months before the body builds up that bacteria count again. So it is great for gum tissue. We use it a lot, though, in periodontal therapy, a non-surgical, to eliminate pockets. It used to be we had to have surgery that, you have to have stitches. It could be bleeding and things like that. It can be more painful. Completely painless now to heal gum tissue using this with no surgery. So we use it all the time for that. I use it a lot to sculpt and recontour the gum tissue, because when we want to smile, we want all the teeth to be proportional to one another. And so there might be areas where the gum is unlevel. So I use a laser to painlessly and non-surgically just level the gum tissue to make people have a more pleasing smile. Ulcers, we treat ulcers and herpetic lesions with them all the time. So if people come to me and let's say they have a sore or an ulcer in their mouth, I can hit that with a laser and almost immediately the pain will go away and it'll heal almost twice as fast just using the laser. So there's tons of applications. Tongue ties, I can release tongue ties, non-surgical, no bleeding, no stitches. It's really, the lasers now in dentistry are great. I mean, we're using them a lot.
It's getting, especially when I talk with you, John, you rarely hear the word pain anymore. We're always associated going to the dentist is going to be very painful.
Hey, man, pain is a bad word in our practice. It should be a bad word in anybody's don't practice. But, dentistry has come such a long way. Even root canals are nothing. I mean, if you can do a filling, you can do a root canal now. Pain-wise, our anesthetics are better. The techniques that we're using are better. The materials we're using are better. I think anybody can get procedures done in dentistry now pain-free. So it's not really a factor now.
That's amazing. And, I don't want to end the show at all without talking about TMJ.
Absolutely.
Is there a lot of new technology out there now with TMJ?
Well, I tell you what, I've been treating TMJ in my practice for 20 years. As you know, we've done several shows on this as well. But the game changer for me is when I use the computer technology to find the bite position for the jaw. What that means is most of our TMJ pain is caused from the muscles that support the jaw joint. In other words, if the jaw's in a bad place and the muscles don't like that, we get inflammation, we get soreness in the jaw joint. So what I use this technology for is, here's a good picture of it. I use this little guy right here where I can place leads on muscles around the head and neck. It's kind of like an EKG of the heart, What I do is I can hook that up to a computer and I can find a position where the muscles are at rest and where the joint is in its most optimal decompressed position. When I find that spot on the computer, I can take an impression there and I can then devise appliances that will place the joint in its optimal location. Much better than a conventional bite guard, which is really arbitrary. Some people get bite guards that are never comfortable and the jaw joint and the muscles never like that position and they can actually get worse just in a standard bite guard. But this orthotic, very, very precise. It really puts people where the joint wants to be, when their most comfortable position. And it is absolutely, once you start doing these kind of procedures, again, use the computer. It's now an objective thing. It's not subjective. In other words, it takes my guesswork out of it when I'm treating these cases.
Wow.
I've had incredible success with it.
Well, what's amazing, John, is you don't just sit back and use old techniques. You're always trying to update your techniques. And I think people, I want them to know it's not painful to go to a dentist anymore, like it used to be.
Yeah, and I agree with you.
And I also want to tell people, we hadn't talked about this, but you do dental implants.
Yeah, we do implants and it's again, I know we've done shows on that as well. And we could talk about implants. We probably need to do another show on that because we could talk about it forever, but implants are to restore person's appearance and function, to feel just like a natural tooth. You can't do any better than a dental implant. And it really is a standard of care, especially when a person's just missing a tooth. We're using this much more than bridges now, and much more long-term success for the patient. But it's a great procedure.
John, give everybody your phone number for those who are listening on radio right now or a podcast, your phone number and your website.
Sure. All right. The phone number is 281-886-3164. And I'm at drvanslake.com. And that's how you can get me.
Hey, John will be back again with us next month. John, thank you so much. I love doing the show. And hey, your parents are in our prayers.
Thank you so much, Steve. Yeah.
Hope you're welcome, John.
Goes another way, but I appreciate you. Have a great day.
Thanks, okay. Take care, John.
All right. We'll see you.
That's Dr. John Van Slate. Rebel, let's go to our long commercial, and then we'll bring our next expert on.
K. Bender Rembaum is a full-service community association law firm dedicated to the representation of community associations throughout Florida. On kbrlegal.com, you can learn more about their offices in Pompano Beach, Palm Beach Gardens, Orlando, Tampa, as well as throughout Miami-Dade by appointment. Several K. Bender Rembaum attorneys are board-certified specialists in condominium and plan development law and assist clients with all matters of community association legal issues while keeping them up to date on new developments that affect their associations. K. Benda Rembaum is also a well-known provider of free legal education for managers and board members. Contact K. Benda Rembaum today by calling 800-974-0680. That's 800-974-0680 to reach any of their locations. You can also visit them online at kbrlegal.com or write to them at info@kbrlegal.com.
And we are back with the Ask the Expert show on W4CY Radio and Talk4 TV with your hosts, Steve-O, Sophia, and their expert guests.
I always love the last Wednesday of the month because I have two of the greatest experts, and this next expert has been with us for several years. Probably, let me tell you something. If you're looking for a doctor, maybe you've just moved to the Dallas-Fort Worth area, our next doctor is amazing. The things that she does in her practice. Let me welcome you to Dr. Daniela Gamboa with Elite Care Clinic. Good afternoon, doctor.
Hey, Steve, how are you?
I'm doing good. I love doing your show. I love the letters that we get about your show. And actually what I did was I went through all the emails about, because everybody knows when your show is now. And I'm going to ask you some different questions that we've never addressed at all. But first, tell everybody about your practice.
Sure, Steve. Like my practice is here in Las Colinas, Irving, and I am a family physician, but also like trained for like hormone replacement. I do a little bit of integrative medicine, a little bit of mix of functional with the traditional medicine. So I try to look at the patient as the whole and not only treat one sign or symptom at a time. So I try to help and go to the root of the problem. We also do some cosmetic stuff, like I have lasers, I have the Morpheus, and we also do the Emode, the Evolvex, that's whenever they started losing more weight and fatty tissue, then we do more of the toning, with help with the appearance of the skin. So it's a lot of fun that we do here, a lot of fun stuff.
And someone asked me the other day, can they use you as a primary care physician?
Yes, so like I am a primary care physician, so like that's what we do mostly. And I take care of diabetes, hypertension, high cholesterol. So we do everything.
Well, school's just starting, and I went to my doctor the other day. And have you gotten your flu shot? Let's talk about immunizations. What all should people make sure they've gotten?
Well, like it depends on the age, and also it depends on the chronic diseases. So, for example, if you are immunocompromised, so you will need the vaccines a little bit sooner than the regular patients. For example, you will need the pneumonia, you will need the booster for the pneumonia, like so, and then you will need other stuff. So if you have asthma or COPD, you will probably need the pneumonia. Then you will need now that there's a indication for the RSV vaccine. And then all of us, we try to like get the flu shot, although not everyone responds well to that. Like, I mean, it's recommended, but not everyone is fan of like having the flu shot, and then we also have to respect their opinions and their desires. So not everyone wants this flu shot this time.
Hey, my doctor the other day, he said, have you gotten your flu shot? And I am so crazy about this, Dr. Gambo. I never get the flu, but I've never had a flu shot. And I'm so afraid if I get a flu shot, I'll get the flu. But, he gave me the dirtiest look. How well do the flu shots work?
Well, it's like they're like recommended and they're pretty good, but it's like everything. I mean, what we have to understand is that the vaccines are not going to it's not going to say like, okay, Steve, you have the flu shot and you're never going to have the flu again. You're not going to have the flu. No, that's not how it works. So basically yes, you may still have the flu, but it's not going to be as severe as if you didn't have the flu shot. So basically you just have like some more like antibodies, like your immune system kind of knows what to do and fights it a little bit better. So you can still get it, but you're going to get it milder. You're not going to have as severe, you're you're probably not going to have the pneumonia or the sepsis that you can go with that, and potential like death, so like that's what kills you, like the pneumonia that has like the whenever you get the flu.
Is there immunization that builds up your resistance?
I don't think I understand very well the question. So what I think what you're asking is it like that the more we do the vaccines, the more antibodies are we going
Like
to get?
builds up your immune system?
Well, it depends on the vaccines, like so for example, if like you were getting the flu shot, so like that is going to help us, and then also it depends on the types of viruses that are. That's why the flu shots are different and they change every year, because it depends on the flu viruses that have been there in the season. So then the next time they're going to like check that and see, okay, this was the flu A, the flu B more, or like the H1N1, and then they're going to take that and they're going to make the vaccine. So not that's why there's sometimes they use trivalent. That's the three different antigens or viruses type of antigens, and then or quadrivalent. Then there's covering for four. So it depends. Like we don't have any more. Like sometimes we used to have like live viruses. Like we don't have them as more. Like it was the spray the one of the flu vaccines. Like whoever they didn't like the needles, they can get that. But that one, whenever it's a live virus, you cannot give that to pregnant patients. You cannot give that to immunocompromised patients. So it's only like a few patients that you can give that because it's a live virus.
I tell you what, I am so afraid of still COVID. You still hear people who are getting COVID, but the
Yeah.
scary thing about it is I had a cold and I went into one of these ER places and they said, well, we have to give you a COVID test. I went, but
Yes.
I don't have COVID. I have a cold. And sure enough, it was positive, Dr. Gamboa.
Yeah. So the thing is that virus mutated so much that now the strain that we are seeing is mostly like, yeah, as if you have a cold, as if you have severe allergies. Sometimes the patient like you, they're like, no, I don't think it's COVID. We do the test and it's positive. So like they have like scratchy throat or sore throat,
Yes.
a little bit of congestion, and like I mean, thank God that it's been like less and less aggressive, like not like at the beginning that was attacking the lungs and everything. Of course, people with chronic diseases can still get really sick from it, and they can still end up in the hospital, like people with COPD, like they don't have a lot of like defense in their lungs. They have like the capacity that is less. Like people that are like going through chemotherapy, they don't have any immune response, or people that are on chronic diseases that are on medications that decrease their immune system as well, immunocompromised. So yeah, so it can still happen, but now what the most I'm seeing is exactly what you described, people having like a little bit of like such a cold type symptoms, and we have to test you.
We got an email from somebody who is just moving to the Irving area, and it looks like she's going to try to become a patient of yours. And she said she went to your website and she wanted to know if you could explain the services you provide for skin.
Oh, sure. Like for skin, like I worked a couple of years with a dermatologist while I was in DC. So I love skin. Like so I can like the major stuff. I can do some skin biopsies, and then if like it's mostly cosmetic, I do the Morpheus, that is microneedling with radio frequency. Then I also do like the Lutronic. That's the one that it's a type of laser that's the um, helps resurfacing your skin, like takes care of lower the brown spots, like helps with the acne scars, the same as the Morpheus. And whenever you combine those two, the radio frequency, microneedling, and the Lutronic, that's the laser, it gives you a really good result on rejuvenation. And it's as if like, I don't know if you heard of the CO2 laser, which
Yes.
we can only use on Caucasians or type 1 and 2 skin, type 2 skin, very light skin. But whenever you combine these two, we can use it in Middle Easterns, in Hispanics, brown skin, like skin type like 3, 4, like that. We can use that without any problem. So that's the advantage of that now.
What about, are you doing laser in the office?
Yeah, so like that's what we do. Like we do the Lutronic, that's the laser for the skin. And then we also have the hair laser removal as well.
Well, yeah, I wanted to save the best for last. To me, you're a specialist when it comes to weight loss.
No, thank you.
I know you're doing bioidentical hormone replacement now. Can you explain what that is?
Of course. So bioidentical is that the structure of the hormone that I'm going to insert in you, because we do pellets or we use like as a cream or as a sublingual, the same as the chemical structure is the same as our own hormone. So that's why it's called bioidentical. And we extract this from the plant. Like most people, they can extract it from like soy or yam, but now because of the GMOs, like we got away from the soy and we use only yam. So like they extract it from the yam, and then that's what we use to make the pellets or the hormones, either in cream or sublingual, but it's bioidentical. So that's what it means.
I got to tell people the pellets. Now, I'm in Florida, and Dr. Gamboa is in the Dallas area. I got to tell you, these pellets, everyone I've spoken to who've done the pellet love it. The first thing they said is their energy level went way up, and they lasted for about 4 to 6 months.
Yes, so like it depends on the patient. So for example, in females, it lasts a little bit less because we put less amount, because females, we need less testosterone, a little bit like less hormone. So we have to combine and do like, it has to like be just the right dose. And it's specific to you because it's like depending on your age, the levels you have, and even your ethnicity, because Caucasians, they may need a little dose different than the brown skin. So so then the the patients, they, as you said, like they love it because they have like the energy. And in men,
Yes.
it lasts a little bit longer because in men we have to give you more amount of like the testosterone. So like it lasts between 20 to 24 weeks. It depends. If you're very active because you have all this energy back, then you're going to the gym, you're exercising more, it may last like 18 weeks, 18, 20 weeks. For females, like 10 to 12 weeks. And it all depends, like so. But it's great. Obviously, like the hormones are excellent, but also that's not the only thing, because we all have to like do like in balance things, because like also we have to, don't forget about our nutrition. Your nutrition is so important, be like your nutrition, like your probiotics. Like I was recently in this A4M bioidentical hormone replacement like symposium in LA, and it was wonderful, like so many things I learned. But it's so important to protect your microbiome, your bacteria from your intestines is one of the most important things that we do. It's like our first line of defense. So if you see that is like one of the best things that you can do is start taking a good probiotic and fiber, because the fiber is the food for the probiotic. And this one is going to help you little by little with many things, because nowadays, like we are talking about leaky gut. We are talking about like many chronic diseases that can come from that. Because if you think about it, if it's our first line of defense, then if it's broken and it has holes in it, all the toxins, all the viruses, bacteria goes directly to your bloodstream. And that's whenever you become allergic to things, intolerant to like certain foods. Then also 90% of your serotonin is made in your gut. Can you imagine that? So the serotonin is the happy hormone, is the one that calms your anxiety and depression. So if you don't have that, then we're not going to really have enough like to work at the level of our brain. So it's amazing how that portion works. And hormones work along with all that. So everything works together. So we cannot just do one little thing. That's why here we do it the whole thing. But we do layering. I cannot give everything all at once in the first office visit, because you're not going to remember nothing that I told you, like maybe one or two things. But like we have to do it little by little. And also, again, all this happened throughout the year. So we have to do it layer by layer. So one time is going to be like, okay, we balance your hormones, you have the energy. Okay, let's heal your gut. Let's help you with this. Let's do this, so all the nutrients that we need. So
Who's a candidate for bioidentical hormone?
So basically, like anyone that is over 35 in females, like we will need more like testosterone because our testosterone starts going down like whenever we're in our 30s, and that's whenever you start feeling the fatigue. Sometimes you hear like, oh, after 40, I'm like, oh my gosh, I'm drained, I don't have energy, and things like that. And we start like not sleeping well. So that's kind of a little sign of like your hormones trickling down, testosterone going down. Any man that at any age the testosterone is less than 600, we also have to consider like replacing it. However, if the guy is too young, which I'm seeing now, like in the 20s, in the 30s, the testosterone levels in the lower side, those men, we have to be careful because they probably want to have kids at some point. And if we give them testosterone, then we're going to decrease the production of sperm. So we have to be very serious and talk to them. So rarely, unless the guy said, okay, I don't want any kids, I had a vasectomy, then okay, I'm going to give you testosterone replacement if you're younger. But if not, then we try to just doing improving their lifestyle, decreasing the amount of like processed food, increasing the amount of fiber, the omega 3 6 Mediterranean diet, probiotics in the life. So many things that we can do to help your own get better and then improve your testosterone levels.
Do you test for testosterone levels?
Yeah, so that's how we replace it, So we have to check not only the total because in the olden days they used to check only total, but total testosterone doesn't give me the all the picture because testosterone is bound to something called sex hormone binding globulin. That's a protein that it transports and it's bound to the testosterone. So we always have to try to do the free or nowadays bioavailable, that is the one that is going to turn on the receptor of the testosterone, and that's the one that is circulating. So that's the one that we test both.
You've almost got an anti-aging practice in itself.
Yes, and I love it. I see how like I can help my patients. Like there's so many females that they're like, oh my gosh, like I love this. Like I don't know what I would do without my hormones and without all the supplements that I'm taking. I feel great. And some of them, they even feel that they saved their marriage, to be honest with you, because that is a big thing, like for guys and for females, like it helps them tremendously.
You know, and I kind of really saved weight loss for last, which is really your specialty. I am still on the Ozempic.
No, that's great, Steve.
And I want to tell, first of all, you definitely lose weight. But I think what's really amazing, Dr. Gamboa, is my blood work is so much better
Better.
now.
Exactly.
Oh my God. I could not, I've got like major kidney problems. And I'm just blown away. I feel better. And, I know people think about these injections, these skinny injections for weight loss, but they're doing so much more than that.
Yes, and I wish, like more and more the government, the insurance companies see this because if we help you lower your weight, everything else is going to get better, like your cholesterol levels is going to be like, as you said, like your risk for developing cardiovascular disease, and especially this GLP-1 that you are specifically, it has shown to decrease your risk for cardiovascular disease, decrease the risk for stroke. So like so many like benefits from it. And just by itself, just losing weight, you're going to improve your blood pressure, you're going to like decrease your mortality, you're going to like improve your cholesterol. So many things that they have to see that it's so important for patients.
And I know there's several kinds, which I thought would lower the price. There's competition out there, but
Yeah.
they haven't done that though. But I got to tell you, it is, and I know that it's you can't just get it for weight loss, can you?
No. Well, there is like FDA approved for there are this it's the same molecule, but it's FDA approved for weight loss, and the same molecule is FDA approved for diabetes. So for diabetes, the GLP-1 It's Ozempic. For the same molecule for weight loss is called Wegovy. Then we have the tirzepatide, that is a newer generation, that is a combination of GLP-1 with a GIP. So these two peptides, of course, like anything, two works better than one. So, and also helps a little bit more with the insulin resistance. So for diabetes, it's called Mounjaro, and for the weight loss, it's called Zepbound. But it's the same molecule, tirzepatide. So, yeah, so hopefully at some point, like either there's going to be a little bit lowering in the prices so to make it more affordable for the patients. I see that one of the companies has been trying to do that. However, it's not enough because Medicare patients, they have limited resources, most of them, and then they are not going to be able to afford a medication that is like $550 a month only for one medication. So that's how, like, I understand they try to lower the prices, but I think they have to still do better. All of them. I understand that there's a lot of money involved in the development of this and the research and the studies and everything, but there has to be a way that they can help with the price so that more people can take advantage of this, because this is a wonderful tool that is helping so many people.
There's been so many products out there in the market, especially supplements, that tell you they curb your appetite. I think, Dr. Gambo, I think I tried every one of those, and nothing really worked. This is the first thing that's
Yeah.
ever really worked for me.
Yeah, like, and then this the supplement, as you know, like it's not going to be like a prescription grade strength, but there is, like, nowadays, like there's this other supplements that they're starting to do some like clinical research, and I love that because, like, I know like some of the supplements are like good enough because they have demonstrated to help. So one of them, like, whenever you mention this, it's called Calocurb. So this Calocurb is a GLP-1 but a mild agonist. So basically similar to what the injections do. It's like this. It's a extract from like a plant, a bitter crop from an island in New Zealand, and it's called amaracate. So this one is like it can stimulate your GLP-1 receptor, the same one that is stimulated by the injection, but milder. So some patients may notice some. So probably this is like a good kind of like help whenever they're coming down from their GLP-1, or like someone that doesn't need a lot of weight to lose, then they can probably try this because they can like take this and see if that will work for them.
It's funny. Some of the people are scared about giving themselves the injection. And
Yeah.
I got to tell you, I'm the biggest baby when it comes to that. But you don't even feel it. The needle is so
So
small.
tiny. Yes.
Yeah, you don't even feel it at all.
And like, and the good thing is like there is like an oral version of it. So like for like the oral version for the semaglutide that you're taking, that is Ozempic for diabetics, is called Ribelsis. So for people that really, really don't like the needles, we can try also the Ribelsis. But yes, you have to have diabetes in order to have this approved. And I know that these other companies are coming up with a oral version of a different weight loss medication. There's another one that is in the pipes also, like one that has 3 different peptides instead of 2. So everything is like getting better, but we just have to wait and see if they will lower the prices.
Dr. Gamboa, I know you give up, 30 minutes each month to educate people. I cannot tell you how much you're appreciated on
Oh,
our
thank you.
show. Tell people how they can call your office to make an appointment.
Sure. It's a lead care clinic at 469-947-6020. And again, just be patient, please, because whenever like you call, there's not going to be a new patient appointment right away. And I was kind of disappointed the other day. I was going to mention this to you, like a patient calls and told them, hey, like right now, like we are accepting new patients for January. And can you believe that they gave me a 1 star in Google because of that? So I was like so
You're kidding.
disappointed. Yeah, you can see it like my reviews, and it said 1 star because he was giving like an appointment later. So, I mean, I don't think that's fair, like
That shows how good you are, though.
this person doesn't know me and then they gave me a 1-star because of that. I'm like, I'm so sorry that it happened, but I'm like, I don't think that that's nice,
Not a problem. Well, we'll see you next month. You're always the last Wednesday of the month at 4:25. Thank you again, Dr. Gamboa.
Thank
God
you.
bless you.
To you too. Like, thank you so much.
You're
Bye.
welcome.
Bye-bye.
That's Dr. Daniela Gamboa. She's amazing. Hey, that's it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.